Scottsdale Bank, calcium was fired. And the reason is they say that he could only make a deposit. And so what we'll hear about is that we're really depositing the calcium in our tissues and our cells. And so we're living as calcified beings. And this is the foundation of what we're talking about when we mention calcium signaling, dysfunction, and ionic calcium therapy in oncology. So we know our good friend, Dr. Tom Levy, JD, MD, he said, all chronic degenerative diseases feature increased extracellular and intracellular levels of calcium. The increased intracellular calcium also results in increased intracellular oxidative stress. Big statements. Calcium supplementation can produce many health risks. I know any of you had a CT calcium scoring test, right? It's a 5-minute or so scan of the coronary vessels to see if there is calcification. We should all do that when we're 40 or above. But with ionic calcium therapy, we don't have that problem, and we'll see why. And here, we see that the basics of this slide is to say that safe amounts of calcium ions are needed and necessary for chronic conditions. And calcium ions going back into the bone and reducing the serum hypercalcemia is very important. So here we see that dosing is important, and it's important to get the serum levels of calcium up, but we can't do this with supplements safely. And so when we're talking about ionic calcium supplementation, we're really talking about low dosages of ionic calcium that will prevent and reverse hypercalcemia and calcification at the tissue level. So we get all these glands working better with respect to the parathyroid physiological responses by providing ionic calcium supplementation. Here we see this was data from a collaborative clinical work with the Calcium and Bone Health Institute and the University of Arkansas Medical School in the US. And to get to the bottom of this on the right, restoring calcium balance, typically there's elevated serum calcium ions, the pituitary gland releases a TSH, thyroid releases calcitonin, we have an increased bone turnover, and then there's a body-wide decalcification, and we're storing calcium balance. And of course, that's what we need. Remember, at the cell level, then it's transferred to the tissue, and also then to the organs. And remember, once we're doing this, we're enhancing that cell function, and we're getting better oxygenation at the cell level. We're getting better detoxification at the cell level. So these calcium ion signaling is providing ideal cellular health. Here we're going to show a patient who had calcific tendinitis. They're in the right shoulder area, and then disappeared 16 months later. So strong bone building and decalcification effects of AIC clears the cellular calcification. I'll say that again. Strong bone building and decalcification effects of AIC clears the cellular calcification. The most dangerous calcification that we can be exposed to is, not having this calcium absorbed, and it really can be considered one of the main root causes of disease, including cancer. And so for this to happen at that, bone area, it had to start at that tissue level. And here's a magnification of the effects of decalcification of AIC therapy. I have my radiologist, interventional radiologist, look at this because I wanted to make sure that I'm presenting something to you, that was vetted a few times by radiologists. Now, if there's calcification in your body and that needs to be reversed now, not not tomorrow, because it's only going to increase, and bone mass density will continue to decrease normally. And here, the Calcium and Bone Health Institute has data for over 1,000 cases of osteoporosis or osteopenia that were treated with calcium ions with very high overall success. And remember, in a DEXA scan, the T-score that is -1 or greater is normal. Between -1 and -2.5, there is osteopenia, and below -2.5, that's when then there's osteoporosis. And in these three patients here, you see that in a relatively short amount of time, there was significant improvement either from osteoporosis to osteopenia or back to normal. And that's one of the things I like about AIC, is we're working on what should affect normal physiology, is that calcium signaling. So what are some of the effects of cancer and AIC? We know that calcium ion creates an alkaline environment that counters the immunosuppressive cancer-favoring metabolite lactic acid. So in essence, AIC has that alkaline effect, if you will. We're taking the patient out of acidity and driving them more into alkalinity or balance. And secondly, calcium ion combines with the cancer cell metabolite ammonia. This prevents the formation of excess glutamine, and this is used by cancer cells, as you know, as a source of energy. Mostly all cancers, but we know for sure glioblastomas and other brain tumors use glutamine quite well. And then thirdly, and we talked about this, we heard about this today, right? The P53, the guardian of the genome. Every tissue in our cells has P53, and we know that cancer cells suppress P53 expression. And so with AIC therapy, we're able to maintain normal mitochondrial function, reducing oxidative stress, and at the same time, upregulating P53 expression. This is huge. We heard before that a certain percentage of cells have P53 mutations. I believe, I can't prove that, but I think most, if not all, cancer cells are able to suppress P53 expression. Thank you, and blessings to you all.
Thank you, Dr. Tony. Terrific. We appreciate it.